For those of you who celebrate Easter, I wish you a very happy Easter. And of course, I want to remind you all to obey social distancing, even though it's a special time of the year and a day you might normally get together with family. Today, I'm very sad to report another 7 deaths in the state of Rhode Island as a result of coronavirus, bringing us to a total of 56 deaths. We have 334 new cases in Rhode Island for a total of 2,349, and we now have 183 people in the hospital. And I'm going to make note about hospitals in a minute. I want to start on a serious note and pick up what I mentioned a minute ago. This is Easter. It's one of the most special days of the year for Christians in Rhode Island, and it's a day that many of us are used to being with our families. And it's going to be very, very tempting tomorrow to say, oh, can't I just get together with my family? Let's go to auntie's, let's go to grandma's, it's just one dinner. We've been cooped up in the house alone for 5 weeks. I am asking you now, please do not do it. Don't do it. I'm not going to do it. It's going to be very hard. This will be the first Easter in my life that I haven't been with my mother, my sister, my brother, all our nieces and nephews. And I hope to never have an Easter like that again. And I hope you never have to have an Easter like that again. Please resist the temptation. I know it's brutal to be stuck in the house. I know Easter comes once a year. By the way, the Easter Bunny is coming. He's an essential employee. But please resist the urge to get together in a large family gathering or with friends and maybe come up with some new family traditions. In our house, we're trying to get creative around new family traditions to get us through this year. The love and the faith are still there, but please obey the social distancing tomorrow. Right now, we are in an incredibly critical period where we still have a chance to make sure that this virus doesn't spiral out of control. And unfortunately, even 1 or 2 or 3 days of letting up on social distancing will really set us back. So when you have that urge to just sneak out to go see Grandma for a little while, stop, don't do it, pick up the phone, call her, and just know that even though it's hard, what you're doing is truly life-saving, not just for you and your family, but for all the rest of Rhode Island. And I also want to remind you, there's a lot of people in Rhode Island right now out of work. It's such a hard time. People have been out of work for a month or more. And I want to get them back to work because they're suffering. So if you hang in there a little longer with these extreme social distancing measures, I can get everybody back to work sooner. So I'm just asking you, do the right thing, and believe me, I know it's hard. The same thing goes for shopping. I keep getting reports of too many crowds in big box retailers, Lowe's, Home Depot, grocery stores. Don't go out if you don't need to. I want you to ask yourself, is it really essential that you go out today to buy supplies for that home improvement project? Because if it's not, you should be staying home. And if it is, then go. But keep a 6 feet distance and wash your hands and wear your cloth mask covering, face covering. If you have to go to the grocery store, obviously you have to go to the grocery store. I know it's a holiday. You want to have extra food for the holiday. Fine. One person from a family goes to the grocery store at a time. Don't bring the whole family, and don't allow yourselves to be crowded. This is very simple. If today or tomorrow you find yourself somewhere in a line, in a checkout line, in a line to get into a store, in a line to pick up food for takeout, and you're close to people, you're doing something wrong. Back up, get space, wash your hands, make sure you have your mask on. This is so serious, and right now, we have a chance to really change the slope of the curve and the timing of the curve, and also buy ourselves a little more time to get ready for when the surge comes. I also want to make a special plea for people who have loved ones in nursing homes. This is going to be very hard. Your mom, your grandmother, your grandfather, your uncle, your favorite friend is in a nursing home, is in a retirement community, is in assisted living, and you're desperate to go visit them for Easter. Don't do it. For nursing home operators, do not relax the ban on visitors, not even to let people go in and give a gift. And I'm asking families, do not try to deliver gifts for Easter. Do not try to deliver a plant. Do not try to deliver candy. Do not try to deliver a gift. Please. That might sound harsh, but it's probably going to save the life of your loved one and all the nurses and doctors and CNAs there and other people's loved ones. And the doctor will have further announcements about that in a minute. We have to stick to these restrictions, even though they're getting harder than ever. If you'd like to go for a walk, it's a beautiful day. I think tomorrow's going to be a nice day. I would encourage you to get outside. Everybody, remember to exercise, remember to go outside, go for a walk, enjoy the day. But do it in a way that's safe. Keep an appropriate social distance. Don't bunch up in large crowds. If you go to the park, don't get too close to each other. And we're going to be out and about. I've been in touch with mayors even today. They're all going to be patrolling outdoor spaces all weekend. Go out and enjoy yourself, but don't bunch up in crowds, because if you are, we're going to break it up. I also want to note that holidays are a difficult time for many people, especially those people who don't have a great support system, who are struggling with mental illness, who might be in recovery, who are struggling with addiction, who live alone, and I know that. It can be a very difficult time. And then on top of the holiday, you're dealing with all the stress and anxiety of coronavirus. So don't let yourself get isolated. If you're feeling like you need help, the help is available. We have a 24-hour behavioral health hotline, and they can connect you with somebody who can take care of you. It's called BH Link. It stands for Behavioral Health Link, and the phone number is 414-LINK. 414-LINK. Don't let yourself be cut off from help, and certainly know that you're not alone. And let us be there for you if you need help to get through the holiday or get through this difficult time. I want to provide you with some reassuring news about hospitals. I'm getting asked very frequently, do we have enough hospitals? Do we have enough hospital beds? Do we have enough doctors? Will we have enough ventilators to meet the surge? And I want to give you some confidence and let you rest assured that the answer is yes. If you get sick, we're going to be able to take care of you. You have a lot of people working literally 24 hours a day, 7 days a week, to make sure we're going to take care of you if you get sick. And by the way, because Rhode Island has done a great job of closing down our public spaces and our restaurants and obeying social distancing, it has bought us time to get ready for a surge. And we've used that time very wisely. We have spent every minute of every day for the past 4 or 5 weeks to get ready for a surge. And that includes at our hospitals. So, as I've said from the beginning, we are working for the best, but preparing for the worst. So this morning I began my day touring the hospitals that are in construction. One at the Convention Center and one in Cranston. And Care New England and Lifespan are working hand in glove to prepare additional hospital beds at 3 sites around the state to make sure that we will have what we need if and when we have a surge. I have to say, and you should know, that what is happening at these 3 centers is nothing short of truly extraordinary and heroic. And to all of you who are out there working around the clock to ready these hospital beds, I cannot thank you enough. I was blown away with what I saw this morning. It is so impressive. We have teams of doctors and nurses and healthcare professionals collaborating around the clock with architects, engineers, medical suppliers, the National Guard, builders. They're working 2 12-hour shifts a day, 7 days a week. Literally 24 hours a day, 7 days a week. And it is what they are doing in preparing these hospitals. They're doing about 6 months worth of work in about 3 to 4 weeks, with great detail and great care. I have heard the word makeshift hospital, field hospital, and it's true, the convention center is not a hospital. It wasn't built to be a hospital. The facility in Quonset was a retail store. The facility in Cranston was a bank. So it is true they weren't built to be hospitals. But I don't want you to think it's cots in a gymnasium. These are going to be top-class healthcare facilities where you can be cared for and where you can get better. And to the men and women out there, I think you're awesome, and I want to thank you for all that you're doing. By the way, it was good to see hundreds of Rhode Islanders working. And I know you're working hard, but I'm so happy that you're there and working, and you're with us in the fight. We also need to prepare our existing hospitals to take on more patients. We've had every single hospital prepare a surge plan so that each hospital can operate at 120 or 130 or 140% of what they normally would. To that end, they need a hand. They need more flexibility to do that, to run these hospitals and to staff these hospitals. So yesterday I signed an executive order that will give our hospital system critical flexibility. We need to ensure that we can care for more patients than usual. I want you to know the hospitals have taken every step necessary to safely accommodate as many coronavirus patients as possible in their facilities. And I want to thank particularly Lifespan and Care New England, our 2 biggest hospitals. You guys have been fantastic. The order gives the hospitals the ability to operate alternative hospital sites. So Lifespan and Care New England will be operating at the convention center and in Cranston and at our alternative sites. We're also taking steps to attract more critical healthcare workers to Rhode Island, and I have signed an executive order to make it so that clinicians can practice at the top of their license, so that retired folks can come back and work, so that nursing students and recent nurses can operate at the top of their license. I want all of our healthcare professionals, they're first responders. And so I'm giving them the flexibility that they need and that every other first responder has in order to meet the needs of the crisis. And frankly, it's necessary because otherwise we won't have enough people working if and when we hit the surge. So I'd also like to take this time, first of all, to thank all of our healthcare workers, truly frontline heroes. Thank you for your bravery. You have to be scared to be going to work, but you're doing it, and I appreciate it. Keep yourself safe. And also to call on anyone out there who has any kind of healthcare training to step up and serve. We are going to need you. If you're a trained medical or behavioral health professional and you are not currently working full-time, we need you. If you're working part-time, I need you to work full-time. If you're retired and not working, I need to call you back up. If you're recently trained or a resident or a medical student, we need you to serve. And I'd like you to go on riresponds.org, riresponds.org, and sign up to help us. And there will be compensation, and there will be training, and we will give the PPE necessary to keep you safe. But I need you to go to riresponse.org and offer your services. A couple of other announcements. It's April, and as I announced a few weeks ago, I have issued a reading challenge for all the kids in Rhode Island in the month of April. So whether you're in pre-K or finishing up your senior year of high school, I'm asking you to read every single day in the month of April. Whatever you want, magazines, books, some of each, but push yourself every day to read. We know, teachers, any teacher will tell you, any educator knows, the most important thing that we can do for our kids while they're doing this distance learning is to make sure they read, read, read. I want you to know, as of today, more than 3,500 students have logged more than 150,000 minutes of reading. That's amazing, 150,000 minutes of reading. I want to give a special shout out to Melrose Elementary School in Jamestown and Portsmouth Middle School. They've each had more than 200 students log reading minutes so far. Way to go, guys. And to every other school out there, let's amp up our reading. It's fun, you'll learn something, and it's the best thing you can do to keep your minds sharp as we go through distance learning. I'm also pleased to announce that at the end of the month, Barnes & Noble will be donating a set of new books to the Early Childhood Center, elementary school, middle school, and high school with the most participation in the challenge. So continue to read and continue to log your minutes and post pictures of yourself doing your reading and videos doing your reading with the hashtag #RIReadsAtHome. I also want to thank Trinity Academy for the Performing Arts in Providence, Western Hills Middle School, and Parkview Middle School in Cranston for sharing a ton of your photos of your staff and your students reading. So not only is this fun and the right thing to do, but if your school reads the most, you'll get the prize from Barnes & Noble. I have to give a big shout out to the public libraries across the state that have been working hard to provide online resources and virtual story times to our families, even though their buildings have been closed to the public. And we have 13 public library locations who are offering curbside pickup for families. This is a tough time, but I love the creativity. Curbside pickup. It's smart, it's creative. Thank you, guys. Thank you so much. Finally, I'd like to recognize several organizations that have been working hard to put together a packet of free books for students across Rhode Island. Books are Wings, Reach Out and Read, Rhode Island Center for the Book, and Rhode Island Festival of Children's Books and Authors. Together, they've delivered more than 6,000 books to schools and meal sites across the state. Thank you. Not every kid is lucky enough to have books around the house, and because of you, 6,000 books are getting in the hands of kids who need it, who are smart and talented, and deserve to have a chance to be able to read. So thank you for your donations. Thousands more are set to be delivered by the end of the month. If you are interested to support their efforts, you can make a financial donation to any of those nonprofits on their websites. So if you, in this crisis, if you're one of the lucky ones, you're still working, and you have something to spare, please consider going on the website of one of those nonprofits and making a donation so we can continue to get books out to all the kids in need. I will say I cannot thank our educators enough. With each passing day, you are getting better and better at distance learning, more creative, more committed, and better at working out the inevitable kinks. So to all the educators out there, thank you from the bottom of my heart, and thank you on behalf of the 142,000 school kids who are learning because of you and your efforts. And to the moms and dads and aunts and uncles and grandparents out there who are in the house giving a hand to your kids in distance learning, I want to thank you too. It's another thing on your to-do list at a time that we're already stretched, but it's working. These kids are learning, and it's because of you. So thank you to all of you. Finally, as I've said so many times, it's a hard time for all of us. It's easy to get down. But I find hope and optimism and strength and energy in the millions of acts of kindness that are happening every day all over the state. And they are happening, and they are extraordinary. So I want to take a moment to highlight one effort in particular. Family Service of Rhode Island is providing home delivery of cleaning supplies and food for some of our most vulnerable Rhode Islanders who cannot afford these essentials. They're getting more than 150 requests a day from Rhode Islanders in need. So again, I would say if you're lucky enough to be in a position that you might be able to spare a bit to help somebody in need, please do it. And you can do it by texting "Be Safe" to 44321 or going to Family Service of Rhode Island's website. So go to the Family Service RI website. They need donations. For anyone who's hearing me, if you're a corporation, if you're a family, if you're an individual, if you can make a donation to Family Service RI, I'd appreciate it. They're helping hundreds of families a day to provide basic necessities like food and cleaning supplies, all the things that these families need. I will say, if you're among the families in Rhode Island who are the most vulnerable, maybe you live at or below the poverty line, maybe you struggle with homelessness or addiction, this is layering on coronavirus on top of that is, it's causing unimaginable levels of stress and strain and human suffering. So please, if you have it in you and you're in a position to help, I'd ask you to donate to Family Service RI and have faith that it's a well-run operation and every penny you give will get into the hands of somebody in need.